All right, gang. So chapter 11, Justice and Access to Healthcare. This lecture is going to talk a bit about how our resources are allocated. And, this topic I feel is very important to most of you after reading through some of your discussion boards and assignments. Also, very important to me as well. Healthcare in the U.S. is in crisis. That's not only my view, but that's the view of the text as well. And hopefully we can get some things solved to this broken system. So Principle 8 from the APTA Code of Ethics says that physical therapists shall participate in efforts to meet the health needs of people locally, nationally, or globally. So this and then the opening sentence of this chapter is, for some time, healthcare in the U.S. has been in crisis financially and morally. The U.S. is the last developed country without an effective healthcare system for all of its citizens. So hopefully you can participate in some reform. Some key concepts in the chapter are going to be this principle of justice, microallocation and macroallocation. So most ethicists today hold the view that there would be no point of talking about justice or fairness if it weren't for the conflicts of interest that are created when goods and services are scarce and people differ over who should get what. Okay. When such conflicts arise in our society, we need principles of justice that we can all accept as reasonable and fair standards for determining what people deserve. Microallocation, they start talking about that on page 149 of your text. Microallocation is when there's an attempt to balance the patient's needs, like the distribution of resources to individuals, or having to balance, or an organization, balance the patient's needs, like the distribution of resources to individuals, or within an organization. And we have to balance conflicting claims. Page 149 of your text actually gives some great examples about how, like, scheduling, for example, one type of conflict involves scheduling resources, scheduling problems. When a clinical staff is overloaded on a given day because a therapist calls in sick, what's a fair way to allocate the time of another staff therapist? And also, so like, who's to say how things get distributed, okay? There's a bunch of examples there on that page 149 underneath the heading of microallocation. We also have to talk about managing patients, balancing patients' needs, and prioritizing resources. Okay, you have two cases to look at in your assignment this week, 11.1 and 11.2. You're going to talk about microallocation. And then macroallocation, you can look at, this is page 153 in your text for macroallocation. And macroallocation addresses public policy issues related to distributing resources for healthcare within a society, whether at the federal, state, or local level. Okay. Now, some types of justice to consider. Distributive justice refers to the extent to which society's institutions ensure that benefits and burdens are distributed among society's members in ways that are fair and just. When the institutions of a society distribute benefits or burdens in unjust ways, there is a strong presumption that those institutions should be changed, okay? So look at what's equal versus what is equitable. Compensatory justice refers to the extent to which people are fairly compensated for their injuries by those who have injured them. Just compensation is proportional to the loss inflicted on a person. And Retributive or retributive justice refers to the extent to which punishments are fair and just. In general, punishments are held to be just to the extent that they take into account relevant criteria, such as the seriousness of the crime and the intent of the criminal. So let's break those down a little bit. So distributive justice. So how do we parcel out the service that we provide? Equality is the condition or quality of being exactly the same as something else. So to each patient, to each person gets an equal share. Okay? Equality means that we serve all patients to the best of our ability. Versus equity. Equity is the state action or principle of treating people in accordance with their differential needs, like fairness. Okay, so equity means that we give service according to a patient's ability to pay or a plan's pre-negotiated equity format. So a plan's pre-negotiated equity format might say that a patient gets 12 visits of physical therapy. That's it. Okay. Compensatory justice in healthcare means that there is access for compensation for wrongs or harms that have been done to someone. We need to consider insurance companies, private insurance companies, Medicare and Medicaid, and also L&I, workers' comp types of situations when we talk about compensatory justice. Page 152, case 11.4 in your text, when it talks about justice in payments, goes into this. And then 11.5 talks about Medicare justice. Okay, I'm just going to go point out the case 11.4, page 152, talks about how there's a therapist named Mark being with this company called Possibilities Unlimited, and they're super busy, and lots of care is being delivered by PT assistants. And Mark, like all the other therapists in the unit, signs notes that are written by the assistants whenever insurance companies honor. So like if the insurance company says only a PT can see this patient, but the assistant is actually seeing the patient, the therapist is signing off. Okay. Now I have to say I've actually been involved in this exact situation. This happens out there in the clinic, but the place that I used to work, this happened all the time. So if the insurance company is saying that only the PT can, they'll only reimburse if it's a PT that sees them. You know, when we get into practice, not saying that this was ethical at all, possibly it's even illegal, as the case points out, but there were definitely times when the assistants would see the patient and then the therapist would actually just sign the notes. Okay, yeah. So this stuff is definitely out there. Okay. Doesn't make me happy. So some theories of justice is going back to what we talked about way back in the beginning of the course with ethical theories. So rights ethics puts an emphasis on personal rights and economic liberties. The distribution choice must be freely chosen. Duty ethics relies mostly on absolute equality and the right to health care. Utilitarian ethics tries to do the greatest good for the greatest number. So one thing to talk about that we haven't yet is public health ethics, especially when we're going to talk about COVID, okay, since we're in the middle of it. Public health ethics, it's a great example of what we're in right now. First of all, prevention of harm tries to focus on the fundamental causes of disease and requirements for health, aiming to prevent adverse health outcomes. So when they put us in quarantine, we're focusing on the fundamental causes of the disease, knowing that it's transmitted by droplets, right? And requirements of health, aiming to prevent adverse health outcomes. So that's when they said go into quarantine and socially distance yourselves, right? Utility and efficiency focuses on achieving the greatest overall good for the population. So again, isolate and social distance. Proportionality ensures that any restrictions to individual liberty imposed to protect the public from harm do not exceed what is necessary to address the actual level of risk or to critical needs of the community. So like wear a mask. Okay, so that is restricting an individual liberty, but it's imposed to protect the public from harm, not exceeding what's necessary to address the actual level of risk. Okay, confidentiality, to ensure confidentiality of information that, if made public, could harm an individual or community. So like contact tracing. Okay. Social justice says to advocate and work for the empowerment of disenfranchised community members, aiming to ensure that the basic resources and conditions necessary for health are accessible to all. So, access to testing. Fair and transparent process to ensure that the public health policies, programs, and priorities are developed and evaluated through processes in which community members have the opportunity for input, are provided with the information needed for decisions, have their diverse values, beliefs, and cultures taken into account. I'm not sure that this happens so much with the COVID-19. Solidarity states that we need to ensure burden sharing and collaboration that builds public trust and the institution's effectiveness. Question mark on that one too for COVID. Institutional responsiveness says that we're trying to ensure timely action based on available information and within the resources and the mandate given. Okay. Now, rationing is another thing to consider when you're talking about how resources are allocated. So rationing is allocation of scarce resources, the criteria and processes for decision-making regarding the fair and efficient use of scarce resources. I put a link in the module for you that's interesting to look at when they considered, it's from the CDC, considered how to ration out PPE when we were in the beginning of this pandemic with a shortage. Okay, so typically healthcare practice is guided by clinical ethics processes that address the individual, and in extraordinary situations like a pandemic, healthcare practice must be guided by public health ethics that address a community at large. Okay. So again, you can look at the criteria that they use, CDC use for rationing PPE as an example of this slide here, okay? And that link is in the module. You can also go to cdc.gov for their recommendations if you want to look into it more. Now, pro bono service is something that physical therapists are actually asked to do as part of the Code of Ethics, okay? Text on page 160 talks about pro bono service. So the APTA Code of Ethics states in Principle 8A, physical therapists shall provide pro bono physical therapy, so without charge, physical therapy services or support organizations that meet the health needs of people who are economically disadvantaged, uninsured, and underinsured. So your text talks about how this is a requirement, shall, not should, as it was in an earlier version of the code. So some suggestions so it's the basic duty of each therapist. It's also the collective duty of our profession. It's the moral idea of our profession. But how do you do that? Especially, so we know why we do it, but how we do it is, you have to be careful as a PTA. You want to go out there and give back to the community, but you also want to be careful that you're not representing yourself as a PT, Okay, so some ideas could be to organize a free clinic, maybe some free kind of patient education, but again, not advertising yourself as a PT. The current students in the first year face-to-face class are actually doing a blog right now. Would not be considered pro bono because they are, still students, and this is part of their clinical education that we're working on. But, they're doing a blog talking about how to keep your posture good while you're sitting more, working from home. Okay, so that would be an example of like a patient education type of thing that you might consider to do pro bono without charge to give back to the community. Okay, you can volunteer to provide physical therapy, say at a local free clinic. You can volunteer at special events that are organized by others, like one-day clinics for the uninsured. You'd want to make sure you have some personal liability protection. Also, you want to make sure that you're staying in compliance with your state licensing laws. Okay, you can organize events in your community. All kinds of ideas that to give back a little bit. All right, gang, that's it for now.